28-year-old priming gravida at 16 weeks, estimated gestational age, presents for prenatal care. Routine prenatal screening tests reveal a positive HIV antibody test. The patient is extremely concerned that she may transmit HIV to her baby, and she wants to have the baby tested as soon as possible for delivery, after delivery. Which of the following would be the most appropriate diagnostic test to address this patient's concern? Okay, this particular question, yeah. So here the option is we do HIV RNA test, okay, PCR for RNA. So in this particular question, what we need to know is that we can do antigen assay for P24 is done actually for adults, okay. And since it is like a window period type of phase, we need, and the immunity of the infant is not active yet, so we'll not be having any antibodies or a good response of the CD4 T cells to the HIV virus. So at that time we cannot use antibodies, we cannot use the CD4 count cells, or viruses cannot be cultured easily, this particular virus, so viral culture is out. So what we do is we do a poly PCR for HIV RNA. We take a sample and we try to do a PCR test for HIV RNA. So we try to see what the real-time viral, it's actually an RT-PCR, real-time viral load we try to correlate to see if there is actually the baby has been infected, because antibodies, we will get positive antibodies all the time because the antibodies are that of the mother. Mother will be having anti-HIV antibodies and that will be transmitted to the baby. So if we do an antibody test for HIV antibodies, it will always turn out to be positive. Okay. So that is there. CD4 count, though, it won't be there. Viral culture you can't do. And so there are only two options. Now if that P24 is done for adults, let's see if we have anything else over here. Serum P is very high in the first week of infection, or undetectable. So yeah, it's in the window period, P24 is there, otherwise it's not there. So the only significant, only reliable test over here is PCR.
Thanks for watching. Please give a thumbs up and subscribe for more.